So there's one product, Ide-cel, Abecma, which has been already approved by the FDA and the EMA, and it's already available as a commercial product in the US and in Europe, at least in France and in Germany. Several patients have been treated. It's mainly considered in patients with 3 lines of prior therapy, at least in Europe, and progressing after the last line. In these patients, we see an overall response rate of about 82% complete remission, beyond 30%, and a progression-free survival in the highest dose level of around 11.3 months, with progression-free survival of nearly 2 years in patients that achieve a complete remission. So in these heavily pretreated patients, and a very impressive treatment result. And in addition, toxicity of this treatment when compared to CD19-directed CAR T-cell therapy in ALL and in lymphoma, it's much better. So we have a low incidence of grade 3 neurotoxicity and grade 3 RS, so between 3 and 5%. So very tolerable, and actually in some of the US centers, they already think about giving CAR T-cell therapy for myeloma in the outpatient setting. In addition, there are other products coming to the market. One product, Cilta-cel, is probably approved this year or early next year. And the update was reported at the last ASH meeting and also here at the European CAR T-cell meeting. And the response rate is 97%, and the overall response rate beyond 80%, and the median progression-free survival beyond 2 years. So again, a really impressive treatment result, again, with limited toxicities. So I think CAR T-cell therapy is really a new option for patients with advanced stage multiple myeloma. And in addition, we see CAR T-cell therapy moving to earlier lines of therapy. So there have been several trials reported in which CAR T-cell therapy is given for first relapse or in following 1 to 3 prior lines of therapy. So, and also in this setting where obviously the CAR T-cells are fitter and maybe persist for a longer time period, and also the toxicity was really very acceptable. So a very good option also for earlier lines of therapy. And I think if we aim for long-term disease control with CAR T-cells, we'll definitely have to position CAR T-cell therapy in earlier lines of therapy.